for being with us today. Let us start the ball rolling with Brunei, and we're really here to learn in a very informal, casual way some of the lessons learned from the ongoing COVID-19 pandemic. And maybe if I can turn to Minister Dr. Isham, can I ask you to reflect, because you have been minister for a long time, you are a cardiothoracic surgeon by training. What are some of the key lessons that you have learned over managing the pandemic right from day one through, and Brunei has been very successful? And given that the theme of the conference is on digital public health, could you also share a little about how Brunei has used technology to help you be very successful in managing the pandemic? Minister, over to you, please.
Thank you very much, Prof. Lim. First of all, I'd like to thank all the colleagues as well who managed to join this morning discussions. As I mentioned before, I think sharing of information is very vital in managing ASEAN pandemic. So just to share with you, in Brunei experience, Brunei first have this COVID was in March 2020. So its initial wave was from import cases. So with this, we managed to control the borders quite well following that. So we sort of try to decrease any importations of the virus by strictly controlling the border. So like making a ring of fence around Brunei. And by doing the tracing, isolation, and treating them in a hospital, we managed to control the epidemic at that time within 40 days. Yeah. And after that, we have more than 400 days of zero community transmission. However, in August this year, we have a large second wave of pandemic through the sustained community transmissions, where involve several large clusters, including schools, essential workplace, and the oil and gas industries. So with this situation, we have to be very flexible and nimble to adapt this change. And from the beginning as well, in terms of managing this, in the first wave, we built our capacity of the lab first to 1,000 per day or 2,000, up to 2,000 per day testing. But with the surge of the second wave, so the idea to isolate and trace quickly, we need to increase our capacity of testing. So now we've managed to increase the capacity to 10 to 12,000 a day. So that's in terms of identifying the patients involved. So on top of that, we also increase our place of isolation within the reach of the National Infection Center, so that all positive patients, we try to isolate them, because we believe by isolating them, the risk of transmission in the community can further be reduced. As you know, in community in Brunei, we tend to have a large family within a residential address. So there might be a few families within a single house address. So the need to have an isolation center is very important in Brunei context. So with this approach and with the use of the Bru Health, which we initiated during the first phase, have helped a lot in trying to do the contact tracing. So with the Bluetooth technology in the Bru Health, we managed to identify who the contacts are. Yeah, although the process is it's up to us to determine, say, how long the contact need to be before you identify them as a true contact. Yeah, you can adjust this. So Bru Health has played a big role and identifying us. So make sure those who are identified as a contact or who has been nearby to this positive patient to be quarantined. Okay, so And the other thing that's important is where we improve the legislation or the law, okay, on how to manage those who break the restrictions, yeah. So these three important things have helped us to manage especially during the first wave, yeah. And now with the second wave coming, we've just started this week where we have a stay-home directive to further restrict the movement of the public to ensure our healthcare system is not strained. So hopefully we can see the results of this stay-home directive within the next few weeks. And with all these measures, we managed to contain the pandemic to a level that where it doesn't strain our healthcare system, and especially the mortality is within a reasonable percentage. So, but on top of that, what's more important, I think, is the transparency of the government, especially from the first wave. The government, especially through Ministry of Health, have a daily conference during the peak of the pandemic, the first wave. And now, since the second wave, we have daily conference with the media and to tell the public to be part of this program where we need the whole of the nation approach to control this and being transparent of what we do and what our targets. For example, now with the Delta variant in the second wave, it's sort of we have to change the plan where the possibility of zero transmission within community might be difficult to preach. So we engage the public. Now the aim is to get a full vaccination for the whole adult community, including the children in next few weeks, 12 to 18-year-old. So the engagement of the public, I think, is very important as well. So we hope that by the end of the year, with the inclusion of the children 12 to 17, we can say that we vaccinate most of the eligible people. Yeah. So basically, the contact tracing and isolation and transparency and the vaccination program are the main things that we inform the public on how to mitigate the situations. Thank you.
Minister, and maybe we can turn to Indonesia now, because Indonesia is by far the largest of the ASEAN countries with 270 million people spread over an archipelago nation. So, Bapak Budi, given that you have such a large country, the strategies will have to be different. What are some of the lessons you have learned? And I'm also mindful that you have come into the position as the health minister relatively recently. So you have some distance to really reflect and to ask what are the learnings and what can we take moving forward. And over to you, Bapak Budi.
Thank you, Your Excellencies. Indeed, this is my 9th month to be in this position, and I'm not as health expert as all of you are, because my background is nuclear physicist, become bankers for the last 30 years, and then suddenly I don't understand why the president put me here in this position. But to share with you, when I came to this position on the 23rd of December, we are coming on the first wave. The first wave is hitting us, and we just follow the expert. We gather all the epidemiologists and listen to them, and I understand that the only objective to overcome this pandemic is to reduce the rate of transmissions, or people said flattening the curve, or the epidemiologist said how to reduce the reproduction rate, or RT, below 1. So I have that operation target very, very strong, how to reduce the transmission rate. And based on WHO input, we stick on 4 key strategies to reduce the transmission rate. First is the health system, health protocols. We call it wearing your mask, wash your hands, or watch your distance. That is the first strategy. Very difficult indeed, because Indonesia is not a very disciplined people. The second strategy is the diagnostic strategy, testing, tracing, treatment. The third strategy is vaccinations, and the fourth strategy is therapeutics. For me, it's very, very clear that the first strategy are the most important one. This is the strategies directing for healthy people before they come sick. You have to manage your health protocols properly. We have to do surveillance properly, and then we have to accelerate vaccinations. And that is what I call an offensive strategy. Very, very important. If you are already beaten up, then you have the defensive strategy, which is the therapeutics. You have to have enough beds, you have to have enough ventilators, doctors, etc. But for me, it is a defensive strategy. I need to focus on the offensive strategy. Unfortunately, when I came, it's already on the defensive mode, because the big wave is already coming. But anyway, we learn. So in every aspect, we try to use technology, because Indonesia is a very large country and geographically is also challenging. I start one by one. On the health protocols, the change of behavior, health system strategy, actually I got inspired by Singapore. They have the Trace Together back in 2020 early. So I remember I asked the ambassador, I would like to copy the IDs, not copy the progress, copy the IDs. He said, oh, okay, it is for everyone. So we built an application called Peduli Lindungi, which is now already downloaded and installed more than 60 million of Indonesian, and the daily usage is at 10 million hits per day. So this application functions as a screening function. So if you go check into the airport, this application will do online checking with the vaccination database centrally, and also the PCR lab centrally. We have now 870 PCR labs. When you do testing, they will upload your data to our central systems across all over Indonesia. And this database will be accessed by Peduli Lindungi as a screening functions. Or if you want to enter a mall, then this application can tell that you are green, means you have been vaccinated, or you pass your PCR test, or you are yellow, you only vaccinated once, or red or black. So it means that you are identified already PCR test positive and you are not vaccinated. So with this screening function, Peduli Lindungi is used also for controlling behavior. Example, if you go to the restaurant and you are yellow, then you have to go outside, and your maximum time to eat is only like 35 minutes. If you are green, you go inside, and you can be 4 people at one table instead of 2 people for one table if you are yellow, and you can stay at the restaurant for more than 60 minutes. The same as the Papua event. If you want, you go to the stadium to watch football. If you are green, then you go to the left, and there will be 1,000 people at one corner, and you can eat. But if you are yellow, you have to go right. It's only 500 people in one block, and you cannot. You have to wear your mask all the time. You cannot eat. So Peduli Lindungi is used like this, and also to do tracing functions, because we have barcode. When you enter every activities, whether it's mall, it's your office, it's mosque or church, or you fly by airplane, we can quickly identify who are you and who are you with at that particular time. So that is one example, the inclusion of technology in the first strategy. The second strategy is testing, tracing, and treatment. What we implement this strategy is we create an integrated database system, as I mentioned to you, where all testing for all labs are integrated in national database systems. And also all tracing are linked to 10,000 primary care facilities across the island, and they can use it from the handphone. So, and it is not only used by the healthcare workers, but it's also used by the police and also army. So they help us in doing the tracing. They are much more widespread than the Ministry of Health officers, and they can help us to do tracing to people. And they also have the health regimen that can help us. And using a mobile phone, they can enter the data right away into us. And we are working also with WhatsApp. So in the United Nations General Assembly, actually WhatsApp used this at Indonesia as example, where there is a cooperation from companies, digital company with a country to help the pandemic. They use WhatsApp. WhatsApp gave us a free services for all of our WhatsApp use in communicating the way the testing, tracing, and treatment is being run. And also in the testing, tracing, and treatment, we also have established a network of 12 labs for genome sequencing. Before, in 2020, we only do 140 tests, genome sequencing tests in 9 months. Now, in 9 months, we already did close to 8,000 genome sequencing tests. So again, this genome sequencing lab is integrated with one database system. And so we know exactly where the new mutations of the virus identified and how to overcome them quickly. On the third strategy is on the vaccinations. On the vaccination, we have massive vaccination program. As per 1 hour ago, we hit 150 million doses. For your information, we started our vaccination program on 13th of January. We reached the first 50 million on the 8th of July in 26 weeks. We hit 100 million on the second 50 million by the end of August in 7 weeks. So from 26 weeks to 7 weeks. And we hit the 150 million yesterday, which is 5 weeks. So hopefully with the speed like this, we are aiming to hit 300 million jabs to 325 million jabs by the end of this year, and 400 to 420 million jabs, our overall target, by the end of January next year. So exactly 12 months after we started our vaccination programs. And vaccination programs is a centralized database. We link with our National Health Insurance application, which is already spread out in all health facilities. So all the health workers can use that system to entry their vaccination data. And this vaccination data, again, working with WhatsApp and Google, we are geotagging all the data. And so we know exactly in which locations our customers has been vaccinated, in which distinct location our patients are not yet vaccinated. So we can align our resources toward an area where in the Google Earth, it is still many rats. So means it is not yet vaccinated, using the geotagging features that Google has. Again, it is an example how to use technology to accelerate the vaccination program. And the last one is on the therapeutic side. We got hit badly on July, August. For your information, our total bed capacity nationally is 400,000. We intentionally dedicated 30% for COVID, which is 120,000. So I told every governors that, since in COVID-19, 20% will need hospitals. If you got 100 confirmed case, 20% we need hospital. If our maximum hospital bed for COVID is 120,000, then we cannot exceed 600,000 confirmed cases. So in July, we hit 550. So it's a very, very scary. But then, thanks God, then we can reduce it. Now our active case is only less than 30,000 and only less than 6,000 people are hospitalized. And again, for this one, we use we establish a hospital. First, what we do for the confirmed case that doesn't need hospitalizations, we realize that they need to be treated. We work with 11 or 15 startup medicine. 15 telemedicine startup companies. Indonesia. Indonesia is pretty good in startup, information technology startup. We have several unicorns. So some of them established a telemedicine startup. So we open the regulations. 15 telemedicine startup can join in, and they do remote consultations. And we also work with the startup. They do delivery. So they give a free service to delivery of the medicine. So those are the real contributions of the Indonesian startup companies. Most of them are technological based. First is to do telemedicine. So the people that need to be isolated at home, they still have access to health services, to telemedicine. And we work with Indonesian Doctor Association across the provinces. So we have dedicated doctors for every cities and region. And using the platform of telemedicine, they can do the teleconsultation services for the people that got isolation at their home. And then if they need medicine, then the doctors can initiate the delivery of the standard medicine, antivirus, antibiotics, and also vitamins, and delivered by the startup in delivery. Delivery startup, because now we have a lot of delivery startup, home delivery startup. Thanks to the startups, then we can deliver health services, and we can deliver medicine directly to the people without actually meeting the health professionals or go to the hospitals or go to the health facility. And then it's spread across the country. As long as the telecommunication facility is there, then you are safe. So basically, again, those are the objective is very clear, how to reduce the transmission rate. And thanks to God, our reproduction rate now is already below 1. And the 4 key strategies is on the health protocols, diagnostic strategies or surveillance, the vaccination strategies, and therapeutics. We involve a lot, and we are using a lot technology to help us, especially Indonesia is geographically is very, very challenging. Thank you.
And thank you very much, Bapak Budi. Very impressive, and I congratulate Indonesia on its fine performance. Can we move to Cambodia now? And can I ask Dr. Van Dien, since you are, like me, you have an MPH from Yale University and very well trained. In all our countries, we have amassed through various really technological schemes, a lot of data. But as the statistician George Box has said, all models are wrong, but some are useful. So in the Cambodian setting, as the ministry ingest all this data, you put them into models, how do you as the decision maker decide which models are right, which ones are wrong, and which ones are useful? So could you share a little about the experience that Cambodia has had in really mitigating COVID and the use of data, and in particular, some of the models? And over to you, Minister. Thank you.
Yes, thank you very much for giving the opportunity to me to elaborate a little bit on the key question on the data management. As you may know that this is kind of a new emerging disease. Although this is not the first pandemic, but somehow we have to learn about this new disease, especially in our healthcare setting. When the imported case was identified, everyone has to learn about how to prevent, how to care, and how to provide appropriate treatment to our patient. And at that time, there was no specific medicine or vaccine to be utilized at that time. But as you may know that managing the pandemic is not easy. It needs a lot of effort. And governance, leadership, and management are matter to us. So that's why we look at how we can work together across the sector in order to cope with the fast transmission and especially the pressure from the public. When I'm talking about the pressure from the public, a lot of many fake news or misinformation or disinformation has been circulated widely, and we have to act quickly. In order to do that, we need the fact, we need information. We need to work with our healthcare workers in order to get the right information, in order to respond to the inquiry from our public, in order to fight with any misinformation or disinformation. So the data that we are using, it's really at the beginning. I think there might be no right or wrong. It's just the matter of learning by doing. And because this disease is really changing our daily life and livelihood of our people. So especially we have to look at oftentimes the people fear and panic to buy things. And after fear and panic, and then it becomes panic and forget about the implementation of the preventive measures. So we decided to look at strengthening our surveillance system and using some sort of data recording at the national level and collect all the data from the sub-national level need to be reported through our current or existing reporting system managed under the Department of Communicable Disease Control. And the other aspect is working with the hospital in terms of hospital management in order to look at how we can better manage the information from the patient. And as you may know that we have several events happen in Cambodia. Last year we have Amsterdam cruise ship coming in, and lately we have foreign diplomatic relation coming in, and then it's become some sort of outbreak. And then later on we have the local and known local transmission happening from a family and then circulating widely in the country. And this year we have the so-called like 20 February community transmission event. It's mean that it's starting from 20 February 2021, and it's still continuing until now. So I think one of the other aspects I would like to highlight here, it's about the people capacity, about the capacity of our staff to really cope with the development or evolution of the viruses and transmissibility of the new variant that coming in the country. And as many other countries, as we can see, the occurring of the disease in the country starting from the imported case, you see? Yeah. So our rapid response team, thanks for the past investment that has been paid off for now, that we are utilizing our preparation in advance and utilize our existing rapid response team in order to collect the data and entering into our national system for analysis. One of the things is how we can make the public trust to the intervention that we are deciding to put in place. This is a really key challenge to us. And initially, it's quite difficult because the people are not used to, for example, wearing masks, wash hand, or more difficult is keeping distancing. So I think we have to work harder in order to explain to our public, and somehow the example has to be presented. And we have to use our media also, using the key information that we have from our system to flow to our public. And in addition to that, the strengthening of the capacity for response at the sub-national level also is our key matter that we try to really train our healthcare workers that they can also go with us in order to respond throughout the country. As I said, health sector to cope with the fast transmission and responding to the pressure from the public alone is not enough. So the pandemic is the multi-sectoral issues that in Cambodia we are applying the whole of the government and the whole of society approaches. And this one is really require a strong leadership and coordination to respond with the solidarity, trust, and multilateral cooperation. And as you may know that using the technology, it's one of our goals that has been applying in our healthcare setting. Because, you know, a lot of actors that has to play important role in this intervention, and the reporting need to be collected, and different setting they may come up with their own different reporting, but somehow at the national level we need to standardize and come up some sort of a digital reporting system in order to see the cases, the how to say, the prevalence, the incident or prevalent cases, as well as the people who die by the COVID-19, plus the referrals from the sub-national level. So this system has been put in place. In addition to that, we are also implementing and following the international health regulation that we need to also work together with our international partner, especially the World Health Organization, that providing also the technical support to our Ministry of Health. Another one, I think maybe like similar to other countries as well, it's about the capacity to detect and using the surveillance system at the country level. And the surveillance system, the existing surveillance system currently used with the updated, and initially it's not the robot system, but somehow learning by doing, then we adjust our system And especially somehow the system we have is not really matching with the current situation of the pandemic, because as we know, the evolution of the pandemic, it's moving fast. You know, the mutation of the virus is also fast. Last year, Cambodia has been managed the situation quite well. We have about 500 cases and 0 deaths. But this year, because of the new variant widely circulating, and it's really affect the life and livelihood of our population. And so it's really somehow make us in a difficult situation to assess the epidemiological situation, and as well as to provide promptly action with the accurate information. And we have to look at, sometimes there are also duplication of the data utilized. We have to acknowledge that, especially at the laboratory setting, because the sample collected and sent to the laboratory for testing, because we respect the anonymously with the respect the right of the people, and then the coding of the sample, and sometimes because of overloaded of the testing, the sample coming in with the limited capacity number of the laboratory that we are having initially in country, that make us a little bit challenge in order to manage. So the PCR testing capacity at that time is also limited. And we need to clean up our data in order to have appropriate information. So we spend a lot of time in order to have some sort of checking and working with our counterpart in order to really, having accurate data for the policy makers or decision makers. And as I mentioned, initially we have only 2 lab capacity that be able to really test. And lately we upgraded or expand our laboratory to having more at the sub-national level, including the gene expert to be utilized. And but one of the observation is really impact to or affect to our quick intervention is the long delay in waiting for confirmation from the lab test. Okay, yeah. So by the way, in Cambodia, we look at also the implementation and adjustment of the policy or adjustment of the measure depending on the evolution of the pandemic. Initially, we put in place about the 5E implementation. One is the early detection. Second is the early contact tracing, and the third one is early isolation, and the fourth one is the early treatment, and last but not least, early education. It means that we are very proactive in providing, utilize the information we are having in hand in order to provide the information or advocate to our public in early, in order that they can be prepared. And lately, with the evolution and the evolving of the new variant coming up, then our Samdech Prime Minister has adjusted our strategy to a different strategy that we need to look at how we can better cope with this fast circulation of the virus. So the first strategy is to continue to prevent the importing of the new variant coming to the country. And second, to reduce the transmission and infection by still utilizing the education measures, health measure, administration measure, and last but not least is the law, implementation of the law that the people need to follow. And number three, to strive to find a cure and reduce number of deaths. And if possible, we would like to see no deaths, okay? But in the reality, probably it's really difficult because it really depends on how the people, individual and the community can engage into the preventive measure. And number four, we explore and manage some sort of the analysis. I said, we shift from the PCR lab testing to the, as I said, is in order to move with the early detection. So RDT, it means that rapid testing has been allowed to utilize with the suspected case, okay? And in any suspected case, then we send to the lab for the final confirmation and to reorganize the quarantine with the strict measures at the quarantine center. And more importantly, we allow the people to have some sort of home quarantine, including the home treatment. And in addition to that, if we talk about the technology, we also use the QR code to implement our monitoring with the people if they entering into any setting like a restaurant, like a shop, for example. They need to have some sort of QR code to be scanned. And the last, not the last one, the fifth one, it's to manage, proper manage the cremation and the burial of the dead body. And last, it's more importantly, it's about the vaccination. As you may know that the vaccination is one of the key strategy for Cambodia too, because as you know that we do not have a specific medicine for treatment. So that therefore, when the vaccine make available, then quickly our Samdech Prime Minister announced to have the campaign, the vaccination campaign starting from the 10th of February. And at that time, once again, we utilize also our technology to manage the vaccination campaign. We established some sort of Cambodia Cambodia online system that the people can log in and can utilize the information that they gone through the vaccination. And first, we started with the targeted 10 million population age 18 above. And after that, it subsequently the announcement also decision by our Samdech Prime Minister, and we start with 12 to below 18, and lately we start with 6 years to below 12 years old. And the result is quite impressive for Cambodia. I may inform the meeting that for the age 18 and plus, we vaccinated 99.14% up to yesterday. And for 12 to below 18, we vaccinated 89.68%. Age 6 to below 12, we got the coverage of 93.75%. And if we look at the total population coverage of 16 million Cambodian, we got the 84.10%. So this is the coverage of our vaccination. And we have all the data in our hand in order to manage our activity. But the challenge for this, when we develop the system, somehow it's not really meet with the current evolution of the activity that we are doing. Sometimes we think initially, but later on we need to adapt and adjust our system in order to meet the demand for the intervention as well as for the policy makers. Okay, yeah, and I think the other aspect I need to touch upon that we may look at utilizing the online system to respond to any inquiry from the public as well. It's the individual practice and the community engagement. And it's really important because the people really pay attention on how they can prevent the transmission. So they would like to learn and to ask a lot of questions to the health sector. And if we do not create any online system, it's quite difficult for us to manage. Right now, I don't know, in my mobile phone, I have more than 10,000 groups of Telegram, or there are some, mostly they are using Telegram here. They have a lot of people who, they gather together and they create like a groups, okay? Yeah, and then they try to chat and send all the information to us. So we manage that. And plus the establishment and under the management of our Samdech Prime Minister, I think Cambodia is really moving towards what so-called the adjustment to our normal life to a new normal.
Yes.
Now we are preparing and we are learning how we can do our business. And by the time that the evolution of the variant still keep going, but as you may know, we cannot lock ourselves. And the way that I see, we need to get out from the COVID-19 box. We cannot just live within the box of COVID-19. Somehow, we need to control the virus rather than letting the virus to control our daily life. That somehow, the people now keep talking about whether we should look at filling our stomach or we have to proper care our lung. But at the end, it come up with the stomach and lung has to go together. So this means that health and economy has to go together, has to join hands together. Yeah. So investing in pandemic preparedness as well as building or upgrading the healthcare facility in order to cope with the pandemic, it's very important for this stage. So no further ado. So I would like to thank you all very much. And any question I may take on. Thank you.
All right. Thank you very much. And let us move to Laos. And can I ask Dr. Bounfeng, what has been the experience of really Laos? And can you focus your comments on balancing lives and livelihoods? Because this has been a struggle for all of us across ASEAN. And maybe if you could answer that in a few minutes, then we can swing the conversation to talk about what we as ASEAN can do better together. And over to you, Dr. Bounfeng.
Good morning.
Good morning.
I would like to apologize for my minister, Mr. Bounfeng Phoummalaysith, at the urgent meeting. I am the Vice Minister to be acting on behalf of the Ministry of Health of Laos. Regarding your topic for discussion, first of all, I would like to convey my sincerely gratitude thanks to Excellency Minister of Health and His Excellency Minister of Finance Economy of Brunei Darussalam for hosting this special minister conference. Excellency Health Minister, ASEAN Health Member States, ASEAN Secretariat and WHO representative. I would like to share with you our lesson learned from managing the COVID-19 pandemic in our country so far. Like many countries in the world, we have facing many challenges in managing the COVID-19 pandemic in our country. What are these challenges? We have seen that during the last period, facing the outbreak, the pandemic, we have faced many challenges, like illegal border crossing. That's one of main challenges. Our country has over 5,000 kilometers of international borders with 5 countries. In April, we saw the devastating effect when 3 people crossing over illegally and mixed widely with the local community and transmission. The second challenge is managing an influx of migrant workers entering to Lao PDR is since July with high proportion of them testing positive upon arrival. Over 40,000 migrant workers returned since 2 July up until 30 September, of which more than 13,000 tested positive for COVID-19. Managing outbreak, managing large outbreak in 3C settings like a factory and workplaces are also a main challenge. Pandemic fatigue, like other countries, our health workers, COVID-19 responder, police and defense sector, government worker and community have been fighting COVID-19 for nearly 2 years. That's causing pandemic fatigue. And the main challenge is economic and social impact and loss of livelihood due to COVID-19 pandemic. And how we have overcome these challenges? We have seen that COVID-19 has shown us that the health sector alone cannot manage the pandemic. It requires a whole of society approach. The public security sector has played an important role in strengthening border measures, strong cooperation and coordination between countries in engagement and leadership of village authority and community to report illegal movement. Further, engagement with community and empowerment of them to participate in the COVID-19 response actively and comply with the public health and social measures are one of the key strategies. Similarly, the influx of migrant workers require a whole of society response with local government authority, military and public security sector being instrumental in managing quarantine facilities. Lao PDR approach was that we should accept and care for our national returning from other countries. Since the beginning of 2020, Minister of Health had made great effort to designate central and provincial hospital for case management of COVID-19 patients, expand isolation facility to increase surge capacity. Healthcare workers have been trained using the National Clinical Case Management Guideline for COVID-19 and IPC standard, and those designated hospital facility were equipped with critical equipment and consumable internally through our external support through the government partner and the private sectors. Ministry of Health has developed the IPC guideline for various settings and recently worked with the Ministry of Industry and Commerce to develop a safe workplace checklist with 10 action points to access factories and workplace to ensure they are COVID-19 safe. Internal and external assessment are conducted, and assessment of not just workplace, but also transportation to workplace and dormitory are conducted. Implementing public health and social measures has been a multi-sectoral decision throughout COVID-19 task force. From the health sector perspective, evidence-based decision-making is made using multi-source surveillance information to provide advice on implementation of public health and social measures. We have seen throughout the country how timely and strong public health and social measure implementation can minimize economic losses in a country. The strictness of lockdown in a long run, and most importantly, has been shown to reduce the number of deaths. These are social measure, public measure, and medical measure we have been used for containment and management of the pandemic. Lao PDR also has strengthened its health system to detect, assess, and respond to COVID-19 outbreak of pandemic. Like our testing capacity has rapidly expanded, with all provinces able to test SARS-CoV-2 using the at least one PCR platform. Our field epidemiology training program, trainees and alumni have been developed to Outbreaks to support case investigation and contact tracing. A COVID-19 surveillance strategy has been developed based on the transmission stage, using a risk-based approach and transmission stage. Multi-source surveillance transmission stage assessment are conducted at the sub-national level and to guide responses. We have mobilized village authority and village health volunteers to support with event detection and reporting to support cross-contact monitoring. At the same time, care pathways have been established, like our isolation facilities have been rapidly expanded to manage and monitor mild and asymptomatic cases. Designated hospitals have been identified and are equipped to manage severe and critical patients, and staff trained for case management and IPC measure. Other measure watch and IPC facility, including quarantine, isolation facilities, and hospitals have been strengthened. Timely information sharing and bilateral coordination are invaluable to suppressing and containing the virus. Yeah. We need to continue to assess the situation using multi-source surveillance at the national level. Like a health technology, we have been used to manage, to contain the outbreak. Like we have application for vaccination certification to register, to check the number of vaccinated people in the country. Application for monitoring quarantine travelers have been established in travelers who traveling to the country. At the same time, we also established the hotline to answer all related questions to the pandemic. COVID-19 does not respect borders, and until every country has managed COVID-19 and vaccinated low risk, we remain vulnerable. Regional and global solidarity is needed in every sector, organization, individual have a role to end this pandemic. Thank you for your attention.
And thank you very much, Lau. I want to swing back very quickly to Brunei because it is very, as our host and ASEAN chair, it is very clear that we are better together. Our countries have learned from each other in terms of technology. So maybe can I turn to Minister Dr. Isham? What would you like to see ASEAN do differently moving forward, right? Given that we are all in this really together, and as the WHO has said, no country is safe until every country is safe. So what can we as ASEAN do better moving forward? Over to you, Minister.
All right. Okay. I think as a region, yeah, and we're very close-knit regional countries, sharing of information or data is very crucial. And especially when the pandemic arrived in a particular country, the sharing of information to all the regions can help the region to mitigate or prepare the possibility of pandemic moving through the region. So I think the preparation of ASEAN Emergency Preparedness Center is a crucial point, I think, and this is hopefully will materialize soon. And through this, hopefully, we can work more closely, and not only in terms of preparedness, but also in terms of mitigation.
Yes.
Now, few things. First, the resources of for example, PPE, masks, and most importantly, vaccine.
Yes.
So if you work as a whole, we should have like a central bank for this, you know. So no country should be in difficulty in obtaining resources for this.
Yes.
So if we have some sort of stock, yeah, where we can allocate certain countries certain stock, especially in the initial response. You see, I believe if we can control it in the beginning, yeah, we control it stricter, and the pandemic won't go through the whole population.
Yeah.
So we should not let any countries, irrespective of the economic status or population, to be in dire. Okay. So the moment we know a country in the region facing something, and we should quickly, as an ASEAN, help that country and control it as quickly as possible. Because as you know, ASEAN is borderless, right? So everyone move around. So the quicker we do this, the better. That's my thought.
Yeah, thank you. And on this point around vaccines and how we are better together, can I turn to Bapak Budi, because it has been reported that Indonesia is exploring setting up a WHO global vaccination hub. Do you see this as being a resource for all of ASEAN? And Singapore has also announced that it is welcoming BioNTech as well as Sanofi to establish manufacturing facilities here. So on this point around vaccination hub status, where do you see all of us working together? And over to you, Bapak Budi.
Will be the president of G20 next year.
Yes.
So our proposed initiative for global health issue, the first one is we need to revamp the global health resilience architecture, because we identified that health is like finance become very, very global issues instead of very local issue previously. And the second topics related with this new global health architecture, we need to establish a mechanism like IMF. I came from private sector, so I knew exactly if there is a balance sheet problems or holes in any country, whether it's fiscal or monetary, then IMF can intervene. So we need to do the same thing in health. And it's not money, it's more of access and mechanism, and it should be participatory, where if you need ventilators, if you need vaccine, if you need access to protective equipments, you need medicine, Actemra or Gamaras or whatever it is, developing of new therapeutics, it should be accessible in a very prepared way, structured way. It should be developed both at the global level and also at the regional level. So it is imperative that ASEAN started this initiative, how we establish a local IMF-like in health sector to intervene if there is a health problem. And component of that is the vaccine hub. We definitely not only, it's actually not a vaccine only, but vaccine and also medicine and also protective equipments, ventilators, all medical equipments that needed for pandemic, it should be distributed quite equally among regions. So for me, the more is the better, especially for high technology like mRNA vaccine platform that is proven can be developed quickly. And the last one, the third initiative, should be on the global health standard. We identify, especially in travel, but it doesn't have to be in travel. It can be in any other human being activities. But in travel, can you imagine if the different document requirement for immigrations? One country need a passport, one country need a birth certificate, one country need another thing. That will be very confusing and inefficient. So we need to copy the innovation on passport for immigrations on passport for health. So when I come to China, I have a different quarantine protocols, I have a different vaccine requirement, I have a different PCR test requirements. I go to Rome, different thing. It's very confusing. At least in ASEAN, we can establish, okay, this is a standard platform. Trace Together is linked with Peduli Lindungi. So every time you move, not only for travel, but you want to enter Indonesian mall, you can use Trace Together. I can enter the Singaporean hotel with Peduli Lindungi. So technology can be used to standardize the health protocols like what we standardize passport for immigration. So those are the three things. One is to establish a new global architecture for health. The second is to establish a backup mechanism like IMF. Is one country need help and they have the health issues. And number three is standardized health protocols across countries. And we can start this in the ASEAN region. Thank you.
Thank you very much, Bapak Budi. If I can summarize some of the key themes, it is very clear that every country has learned from every other country. We have borrowed technology, we have borrowed frameworks to learn from each other. And this has largely occurred because we in ASEAN truly believe in ASEAN solidarity. The sharing of information, of expertise has been somewhat informal initially. But as Bapak Budi has correctly mentioned, it is time now for us to redesign the global health security architecture, and we can start here in ASEAN. And I think every country has done well, but as a region, we can do even better. We are down to the minute, so I want to give the last two sentences to Brunei as host. And Dr. Isham, the sub-theme of the conference is collaborate for a happier and healthier world post-pandemic. Could you say a minute about mental health and what do you think we can do better? Over to you.
Thank you. So, apart from the saying that no one is safe until everyone is safe, I think it's most important we don't forget or overlook the mental health. So I think being transparent in ASEAN on how we manage and what's the occurrence of the pandemic will help to alleviate the mental situations of the people in ASEAN as well. So we've experienced from all over the region, I hope, as we learn to progress, we should not overlook the mental health, and there should be a mechanism where we can share on how we address this problem as well. So with that, thank you.
Thank you very much. And we have come to the end of this session. Thank you to all four ministers for very candidly sharing the challenges that we have faced. And I'm certainly optimistic when we go to the next pandemic, we as ASEAN will be much better prepared. So thank you everyone, and thank you to all our viewers.